Hi, it's Paul Banis of GreatDad.com, and thank you very much for joining either the podcast or the YouTube version of the podcast. I'd really appreciate it if you took just a second to subscribe either on your podcast app or in YouTube. It doesn't really do anything. It's not going to send you any emails. It's just going to show up more often on your feed, and it does me a lot of good in terms of getting more exposure for this work I do to support dads. I'd also like to invite you to come to my page, GreatDad.com/go, if you'd like to discuss more about any of the issues that we are covering within the podcast, especially if there's any way I can help you to be a sounding board in your own struggles to be a dad and to be there for your family. So take a look at that. It also includes a link to my course on gratitude, where at GreatDad.com/gratitude with a offer to take that course for free. So see you in a second. Hey, it's Paul Banis with GreatDad.com, and I'm here again with my weekly series talking about modern fatherhood, and we're going to kind of mix it up a little bit today and talk about a subject we don't talk about a lot since we're usually talking about kids, but we're going to talk about sex. And I've got an expert here, I think, who's going to really give us a lot of input. Elliot Justin, welcome to our show.
Great to be here, and thanks for inviting me, Paul.
I know you don't seem like the type of person that would be upset that I didn't call you Dr. Elliot Justin, but you are a doctor in emergency room.
I'm a medical doctor and a researcher, but I frankly just call me Elliot. I'm fine.
I love that. I love breaking down those boundaries. But you've got this incredible background. I mean, emergency medicine. You're one of the pioneers in that. But also you've been working in technology, especially in the area of cardiovascular disease and diabetes, but also what you're calling erectile neuromodulation. Is that what you've been doing mostly?
Well, that's actually how it started, although we're not doing neuromodulation. Yeah, I mean, years ago, I live in Montana, and quite a few years ago, I was joyfully riding a horse. My wife says I ride like a 15-year-old, but I say I ride like a 30-year-old. Anyway, I'm kind of quite feckless, and I broke 6 ribs and 6 vertebrae, and fortunately did not damage my spinal cord. But that got me interested in the modulation, neuromodulation of sexual health. Mm-hmm. So what everyone knows about neuromodulation, because I don't know that word, but almost everyone knows about cardiac pacemaking, which involves putting an electrode in the heart, a battery box, essentially a generator under the clavicle, and it can pace your heart. Well, imagine doing this, being able to do the same thing for human sexuality. Imagine the impact on an aging population, for that matter. So after I had this injury, I read that there were 5 or 6 papers in the urology literature, and it always kind of amused me when we talk about the medical literature, the research literature, because literature means fiction, and a good deal of medical research is not reproducible and it probably is fiction. In this case, I think that's what happened. So there are 5 or 6 papers saying that by urologists around the world, peer-reviewed papers, saying that they're able to neuromodulate, restore sexual function in men who had spinal cord injuries or who had multiple sclerosis. And that involved planting electrode by their pudendal nerve and cavernous nerve, every guy's or woman's 2 favorite nerves that no one knows about, because the nerves are responsible for arousal and orgasm. And I tried it out on 2 rams, and got erection ejaculation, but also got defecation, urination. So it wasn't exactly bedroom friendly. So ordinarily what someone would do is they'd go out and raise $12, $15 million, go down to Colombia or Brazil and test this out on men with ED. But instead I thought, let me just try it on myself. So I had a friend of mine, a urologist, implant these electrodes by my cavernous and pudendal nerves, which are right above the pubic bone, and I felt nothing. And I just dropped the idea. Well, actually, I didn't drop it. I tried to get it published. I called it Project O for obvious reasons, and nothing happened with that. But years later, about a little over 3 years ago, a urology professor, a really famous urology professor, Dr. James O'Talley at the University of Utah, heard about Project O and said, I got to try working with this guy. What he wanted to do was embed sensors into a condom ring-like form to count to get at the number of nocturnal erections that men have.
Right.
So I call this, well, what's going on in the night shift, guys? Because everyone knows about morning wood, and no one wants dead wood. But healthy man should have 3+ nocturnal erections per night.
Right.
From age 25 to 70. I'm 72. And this doctor, like most straight doctors, is what I call a cock ring virgin. Those that play with them. I'm fortunate to be married to someone who enjoys sex toys. And by the way, my advice to any man: look for someone who enjoys sex toys.
Probably a little bit late for the dads in our audience.
Yeah, well, if
they've already made that choice,
if you consider me a second wife, yeah, it probably is too late.
But that is, I mean, we are going to talk kind of frankly about some of these words like a cock ring, which it probably is entered more into the vernacular now than it would have been thought of.
Well, that's what we've done, Paul. My thought was, let's measure all erections, because what do men care more about? The ones that are having a night, or the ones that they're having when they're trying to have sex? So my thought was to embed sensors into a cock ring. I prefer to call them erection rings,
right?
Because they actually support erections. Women have vibrators, and they've been mainstreamed in my lifetime. They've gone from something that women were supposed to be embarrassed about in the 1970s and 80s. Oh, you need to come during penetrative sex. You'll be vibrator addicted. And now they're mainstreamed. I don't know how my wife owns. My daughter takes them on dates. They're whether United States or Australia or UK, even in in Asia, they're mainstream. And then they should be. And they're not seen as a crutch by women. So I prefer to use the phrase erection ring, because all cock rings will help men. But the problem is most cock rings suck. They're these hard silicone rings you can buy in a sex toy store or online. And they pinch, they're uncomfortable, and they can be dangerous if they're worn for longer periods of time, because they cut the arterial circulation. So that's the cock ring problem. How do we make cock ring that helps men last longer, get harder, have more intense pleasure, be more confident, satisfy their partner more likely? How do you do that? Comfortable. How do you do that? And I wasn't thinking about, that's the cock ring problem. I wasn't thinking about solving that, but I have solved it, because in order to count the number of nocturnal erections overnight, we had to reinvent the cock ring. So instead of these hard silicone rings, our ring is made out of elastomer. Why? Because elastomers allow the arterial blood to flow in. So we don't cut off, because we want a ring that can be worn for 8-10 hours when men are sleeping. We want a ring that can be worn overnight. So we changed the material from, here's silicone. This is it's kind of stiff.
Right.
We changed it to elastomer, so it's soft and comfortable. And so while collecting data, we also ended up developing a superior, I don't want to call it a toy, a superior erection ring to help men rock harder, last longer, and have more intense pleasure. So, a lot of guys will say, probably many of your listeners say, well, I don't need that. Well, it's not really about need. It's about want. Do most women need a vibrator? No, they can use their hands, but they prefer a vibrator for many reasons. So when I talk to especially straight doctors about this, they'll often react like with a sort of male pride thing. Oh, I don't need that. Well, it's not about need. It's about want. Do you want to be better? Do you want to be better, perform better in bed, and have more pleasure for yourself? And the answer from that for every guy should be yes.
So let's back up just a little bit in terms of the context of what I know. I think you said you didn't like this word, but erectile dysfunction in the possibility.
I'll explain why.
Sorry.
I can explain why too. Go ahead.
But you just where the lack of having a stronger erection comes from, and how it changes over time, or related to disease or some other factors, and how this changes over time, and where men may need it because of, stress factors, or inability to become aroused, or problems with their partner, or so many other reasons why the problem. I mean, there's one part is, I guess, is a problem. Another part is optimization of the sexual experience, right?
Right. Well, all men should want to optimize their experience. But that said, I don't like the phrase erectile dysfunction. I'll explain why. And it actually relates to the two great medical discoveries we've made about men's sexual health. Because as I mentioned before the show, we have documented almost 70,000 erections. No one else has a database like this. So the doctors, one mistake that doctors make is we generalize from the sickest to the well. Mm-hmm. And they're two totally different groups. So ED breaks down to two groups, crudely. There are men who can't attain erection or struggle to attain erection. That's about 10 to 12% of men. And that's who the academic urologists are seeing in their clinical practice. And they generalize from them. Well, the urologists like to say that the penis is the canary in the coal mine of cardiovascular disease. Well, these men, if any of your listeners, if you struggle to attain an erection, it's far more likely than not that you have a major cardiovascular problem, and you need to see a cardiologist and neurologist. You could have diabetes, hypertension, and a lack of the inability. This is why data is important too, because if a man gets our technology and is having 2 or less nocturnal erections, that man is far more likely than not has a significant disease and needs to get it assessed. And those men could be even men today, men down in their 30s, given the issue.
That's really important, because I think a lot of people think that, I mean, based on the Bob Dole showing up those commercials, that ED is something that affects 70, 80-year-olds, whereas there are younger men who are affected by it, and it's not natural or normal to have that large an issue when you're
correct. And we've had 2 men in their 20s with significant adrenal problems who were thinking, I can, the problem was with my wife, or the problem is with my drinking. If that guy didn't even drink that much, that guy had. So anyway, these men ended up having adrenal value. These guys were significantly low testosterone, and needed an evaluation as to what was causing their low testosterone. They needed these supplements, and the ring helped them discover that. We've had a guy in his late 40s, another one in his 70s, an older person like myself, who will end up getting cardiac catheterizations that I'm aware of because their numbers were low. But here's what I dislike about dysfunction. Here's what we've discovered. So these men who can't struggle to attain erection or can't attain erection, that's dysfunction. And Paul, I don't know how old you are. I don't think you're as old as me, but you probably remember there was once a time back in the 70s and 80s, even early 90s, when women could still be described as frigid, anorexic, or hysteric if they had sexual problems.
Right.
And the feminists came along and they killed those words. And it's a good thing, because we don't want people to be ashamed. We want people to seek help. So the guy, I have no problem with the guy who can't attain an erection. That guy has dysfunction. But most men can attain an erection and lose it, like 85% of men who have ED. And those guys have a problem. They have an issue. That's how, and that's how the gynecologists approach female sexual dysfunction. They'll tell the women that you're dysfunctional. No, they recommend hormones, they recommend vibrators, they're things that they recommend pelvic floor exercise. They're positive things that they recommend, and men need to think about it the same way. So, and why is that? Because most men's problem, can be addressed with a ring. All men should consider putting a ring on. Let me explain why.
Versus drugs, versus Viagra.
Versus drug. Well, a ring is a non-pharmacological solution. Although if men, tadalafil and sildenafil, Cialis and Viagra, they work. They put more blood in the penis. But if a guy can attain an erection, his primary problem is not getting blood in the penis; it's keeping it there. So putting more blood in, that's good. Take a pill. But a ring should be considered as first-line therapy by most men, and that's what we're learning. So I'll illustrate with my hands. The incidence of erectile dysfunction goes up 10% per decade after age 45.
Right.
The expectation of the cardiologist and neurologist that as the incidence of erectile dysfunction goes up, the firmness of sex erections will go down. The firmness of nocturnal erections will go down. The number of nocturnal erections will go down. Well, for the vast majority of men, that's not happening. Because again, the doctor's reason for the sickest people in their office. If a man has angina, if a man's on the verge of getting a heart attack, and our device can help identify those problems. But if a man has angina, heart attack, severe out-of-control hypertension, out-of-control diabetes, then those numbers do deteriorate. Their sex erections do go down. Their nocturnal erections do go down. But that's not happening with the vast majority of men. They're getting ED, but their dick is staying hard, and then they're losing it. They get erections, and they lose it. And the question is, why? And what can be done about it? So the reasons why could be multifactorial. It could be, obviously, it can be psychological, performance anxiety, confidence. Look, I've been married 37 years. There are issues that people don't want to discuss in marriages, even in young marriages. There's boredom. There's a lack of friction. There's distraction. And then there's alcohol, recreational drugs. We doctors also prescribe cock killing.
And I've also read that pornography is playing a role too in the fact that the arousal doesn't function the same way as it does before.
Well, I want to talk about that because my take on that is different about porn addiction. So I want to get to that in a moment. But let me just make this
well,
point.
listen about yeah. Go ahead.
So every erection ends in blood leaving the penis. So the answer for most men is, I need to slow down blood leaving the penis, and only an erection ring can do that. The PD5 medications, Viagra, Cialis, they put blood in, but they don't keep it there. All men should consider putting a ring on. Our ring, of course, because Oz is the only one that's designed for comfort. Oz is the only one that's safe for hours of sexual play. If a man is up or partner or up for that, but we need to stop the blood from leaving the penis, and that plays in with confidence issues. Because a man who's worried about blood leaving his penis is a man who has confidence, performance anxiety issues. Every man can prove this to himself right tonight. You can prove it to yourself tonight, Paul. All a man has to do is get rock hard, alone, no other variables, no partners, avoid alcohol, drugs, and just go whatever your imagination, Pornhub, XNXX, whatever one guy goes to get hard. Get hard, and then stop, and see how long it takes your erection to go down. It'll be about 25 to 35 seconds. Then get hard and put a ring on it, and it's going to take two or 3 minutes to lose your erection. And then if you add tadalafil, it'll take about another minute worth of erection time. So what is that saying? It's saying, men, put a ring on, not as a crutch, but as an acceptance that this is a performance enhancer for me. I should be doing something it's so easy. And again, this is what the data is showing too. This enormous data set is showing that most men's problems, is not with the pump, the heart, or even with the arteries, but it's with confidence and blood leaving the penis and the interaction between the two of those things. I'd get back to porn addiction right now if you want. I hear a lot about porn addiction, and I've been asked. It comes up in panels that I've been on, and I frequently get asked that question. And I think on podcasts, and I have a very different view on this. It's kind of like what I just talked about with the doctors. The doctor's reason for the sickest people onto the general population. What do the sexologists and the urologists do? Well, especially psychologists, if you've got someone spending 4 hours in their basement and they're watching black stiletto high heels for 3 hours and whatever, and a half hour of strap-on sex, that's addiction. But a lot of the porn addiction stuff that's being blamed on men has to do with the fact that most men, as they get older, get less stimulation from the vagina. And why is that? Well, this hand has a brain attached to it. This hand can deliver a lot more pleasure than a vagina. It's very different when a man is 20 years old, 15 years old, 25 years old. But most men, as they get older and they lose their erections more easily, they need more stimulation. They need more friction.
Right.
Ideally, friction with a little bit of lube on it, of course. But they want it. Here's a common story that I hear from men from age 35 up to most recently 66. I have sex with my wife. I get hard. I go down on her. She has an orgasm, and then she wants me to penetrate her. I get kind of hard, and then I lose it. Well, one thing, a ring will solve that problem, because a man who has a ring on is not worried about losing their erection. But and then if you ask those men, well, what do you feel when you're losing it? I commonly hear from them, I don't feel enough to get off. Well, that's not porn addiction. Their hand is superior to a vagina in terms of delivering the pleasure that they want. Now, the answer, of course, is for their partner, male or female, usually female, to use their hand, and for men for the couple to communicate better about what is going to lead to a satisfactory climax.
I guess the theory that I keep on hearing, and I think it's important to talk about, is that, and there's probably a lot of theories that have no actual studies behind them to prove anything, but that porn is providing a level of stimulation or fantasy that they don't end up getting in the bedroom. So their wildest, crazy, 50-person orgy is not actually happening in the bedroom. So therefore, there's that disconnect, and that's the reason for the sudden loss of arousal, because it's not matching up to thetheir greatest fantasy. Does that seem possible, or is that just
their wives are thinking the same thing? I mean, 40% of porn is watched by women. I'm skeptical of that. I think that people, I think, in the end, these men who are and I open my calendar 5 hours a week to speak to people, and I hear about porn a couple times a week from from men. The and when I actually try to advise or treat these people, and successfully in many cases, my advice is you got to get your wife to use her mouth or her hand. You got to put a ring on it because yes, your fantasies might be to having threesomes or foursomes, but a man who's not worried about losing his erection, a man who has a ring on, is very different than a man who's worried about losing his erection. That it's totally, so I believe there's largely a confidence and communication problem rather than, hey, I put it this way. Women, they like to say that porn built the web, and it did initially.
It leads a lot of technologies.
But now
Video
it's shopping.
cameras
But now it's shopping. How much more time do women spend shopping online than the average man? Not your incel hanging, your freak, if you will. Excuse me, that's unfair to me. Your outlier, but your caricature of an incel hanging out in the basement watching kinky stuff. Yeah. How much time does your average man spend watching porn a day compared to how much time a woman spends shopping? What do you think women are thinking about when having sex? This is something that people don't want to discuss either. But there's research that shows that women are much more distractible, even when they're turned on, than men are when men have an erection. I'm actually one of the most. I mentioned two of the most common complaints that men have about their wives that they don't want to communicate: lack of friction. What guy wants to tell his wife your pussy's too loose? That's kind of a buzzkill in bed. I don't recommend that to anyone. The other one is boredom. Hey, honey, we've done this position 1,000 times. Because if that's the position the woman likes, the man's going to try to satisfy her and himself in that position, even though it might not be what he really wants. But the third thing that I hear relatively frequently from men, and I've experienced it with my wife, and our two sisters confess to it as well too, is women in the middle of sex and start talking about something else, and that can be a turnoff for a guy as well too. Like, I don't want to hear about my mother right now, or your mother, or something that happened at work, a fight with the kids. To look, I'm a guy, obviously, and when I first came up with a ring, which would be about really 2 years ago, February, it was I was wearing the prototype. My wife and I can test it out. It was winter in Montana, and my wife said that in the middle of sex, she suddenly remembered, I left the garage door open. It was snowing. Right. Well, there isn't a marriage in the world where the woman's going to jump out of bed and say, I'll take care of it. No. So the guy's not take care of it. And also, the guy usually has to gird their loins in some way. And so anyway, I go downstairs, and not only is the garage door open, but her car door's open. She's probably been bringing in groceries. And ordinarily, for me, her talking about the garage door being open in the middle of sex, close to climax, it would have been a male WTF moment. I would have gotten angry. I'm married many years. I would have gotten irritated. I would have gotten irritated and say, hey, I'm turned off now.
Right.
Why are you talking about this? Instead, I'm still hard as I'm walking around the garage. I come inside and she calls out to me and says she wants some tequila. Well, now for me, that would have been a real WTF moment where I actually would have said, what the fuck? Get your own tequila. I'm done. How can you get angry? Instead, I come upstairs and she laughs because she says, well, the garage door was true, but the tequila was a test of the cock ring. And because I still had a hard on. And a guy who still has a hard on after 5-7 minutes of walking around the house is thinking very different. That man wants to get back to sex, as opposed to that man telling his partner just what he thinks of how she fucked up the night. So there's a personal example of how the ring can compensate for stress and distraction. Stress on my part and distraction on her part. So go ahead.
I can see this as it's a huge issue for a lot of men, no matter whether because we're talking a lot to a lot of dads, and you've got 3 kids, so the ups and downs of having kids and all the pressures of the family, the changing dynamics of the relationship, changing body of the female. There's all these things that go on, and I think a lot of men probably are going through that period of time, and especially the younger ones in our audience are not thinking. They're not thinking that they've got the problem necessarily. They're worried about their spouse. So I guess the question is, in your research, how often is it the the wife who's complaining about the husband or secretly complaining about the husband not being aroused enough or not being hard enough or not being into it enough versus the man who's saying, wow, I never thought I'd lose my entire sex life because, as a trade for having kids.
Well, I have not researched that, but I spent most of my life working in the emergency department in a largely female environment. And it was my observation that it's sort of a 60-40 proposition, that 60% of men desire more sex than 40% of the women, but there are still 40% of the women who desire more sex than their partners.
Wow. Yeah.
And often they're with the wrong
mismatch.
person. Yeah.
Wow. That's if that is true, that's an amazing statistic, because I think a lot of men would probably think that, popular culture would suggest that it's
90-10.
Yeah. 90-10. Yeah.
Yeah. Well, I don't think it is. I would have thought that as well until I worked in the ER. I worked there for decades, and as I think you can tell, I like talking about sex. One of the reasons why I enjoy this business so much. And women, when they're in a largely female environment, they like talking about sex.
Right.
And I think that 60-40 is probably where it is. I do think though that things are going to change very quickly for people in long-term marriages or for older couples, because as women start using testosterone replacement therapy for menopause, that's going to be very interesting, because the complaint that I hear from several men when their wives start with testosterone is they can't keep up anymore.
No, versus progesterone or estrogen treatment.
Well, yeah. Well, for most of my medical career, hormone replacement therapy has been controversial.
Yeah.
And finally, the use of estrogen, progesterone, postmenopausal women has been accepted. But what hormone is missing is testosterone. Menopausal women don't produce any testosterone.
Mm-hmm.
Well, they need it. And they need it not just for sex. They need it actually to maintain muscle mass. Same reason why men need it. They need to maintain muscle mass. They need it to stave off osteoporosis, soften the bones. But testosterone in the right dose, in my experience, and the experience of urogynecologist females I know who are treating women, it's a game changer for women. Women can recover the sexuality they had when they were premenopausal.
So is that true for men as well, that men should be doing any kind of progesterone or estrogen treatments at the same time?
No, because they inhibit testosterone, but every man, one of the things that's wrong the way in which we treat men is we do not make testing of hormones, both male and female hormones, and men produce estrogen as well. We don't make that testing normal. So,
Right.
after men are like 45, 50, if we went to a doctor and they just said, "Hey, Paul, you look cool. See you next year." Well, you would think, what the fuck is this, 1900? How about an electrocardiogram? How about checking my blood pressure?
Right.
My lipoproteins? Am I anemic? You expect a whole panel of blood tests.
Yeah.
But testosterone and estradiol should be part of that treatment panel for men, and it's not, and that's wrong. And it's part of the whole doctor mentality where we kind of minimize the importance of sexuality to people. So I take testosterone, and I know many men at my age who take testosterone, and the benefit can be twofold. And I like to make the benefit objective, because when you go to a doctor and say you might need testosterone, they'll ask you questions like, "Hey, how's your energy? How's your libido? Are you sleeping well?" And those things are subjective. I want to make it objective. So if a man is considering testosterone therapy, one, he wants I'm 72, but this could be any man in the 50s on up. One of your goals is you want to retain muscle or gain muscle. So establish a baseline. Don't make it subjective. It's not about how I have more energy or I recover from more fast from injury. Make it objective. Put a tape measure around your biceps and around your pectoral muscles. Continue with a regular workout. Start testosterone and see whether you're gaining or sustaining your muscle. That's what I did. That's why I take testosterone. My upper body strength increased significantly, about 8 to 10% on curls and bench presses without pushing it. That took me aback. I was surprised. Now some of the urologists I work with thought that I would have more nocturnal erections, and they'd last longer and be harder. And that didn't happen because I don't really have ED. I'm in relatively good cardiovascular, health. But I have patients And there's also research using our technology that shows that men who's going to start testosterone therapy, establish a baseline. You're a guy. I'll make it up. Mr. Joe is 65 years old. He notices that he doesn't have as much energy. He seems to take longer to recover from injury. Get your baseline testosterone and get a baseline erectile. Use our tech ring to establish your baseline of nocturnal erections, how hard they are, how firm they are, and then start therapy. And we've had men they can see that testosterone is working because their nocturnal erections are showing more health in their penis. And that is part of the value of what we're doing, because we make it objective. We make testosterone therapy, shockwave therapy. If a man's taking a PD5 medication like Viagra or Cialis, what's the right dose? It's kind of weird. Paul, if you're a patient of mine,
one size fits all, I guess.
Yeah, you got it. It's not should be one size fits all. It should be scientific, the way we treat blood pressure.
Right. Well, I think it's an important conversation to have, because I think one end of the spectrum, we've got more porn than we could ever deal with, and on the other side, it seems like we have as much shame as we had during the Victorian era around so much of this, and men need to be informed about it rather than pretending it's some sort of perversion to have any interest in sex after age 25, which seems to be the view of a lot of people. Whereas I think a lot of men are also then suffering silently post kids and not having an active sex life, either because there's no interest or because, as you say, they lack the functionality, and now it's become another private shame because they don't feel like they can perform in the way they used to.
Yeah, or if they have a problem, instead of getting it assessed objectively, which they can now do with our tech ring. They rely upon conjecture, friends' opinions. I mean, when it comes to sexual health, a man who has a problem, and most men who are interested in fixing that problem, they'll walk on broken glass for a solution. They'll consider almost anything. Now they can actually make those anythings objective. So if you're thinking about shockwave therapy, establish what your nocturnal erection is doing. If a man has 3+ nocturnal erections per night and can't perform in bed, their issue is a confidence issue, and it's not going to be. Right. You're not going to be able to pound down Viagra or men's virility supplements. That's not really going to be the answer to your problem. The answer is likely to be, assuming it's not alcohol or recreational drugs, the answer is likely to be it's in your head. And it's probably in the relationship with the person that you're with. Yeah. And that's something that people need to deal with. And having data is valuable in terms of sorting it out, because couples want to know, is it something physical going on, or is it something personal? But learning that it's something personal, that can be dangerous as well for people to deal with.
Yeah. How do you recommend that that couples talk to each other about this? Because it just does seem like such a fraught issue with so many accusations and questions and vulnerabilities and all the rest. And
well, that's where the data is valuable, because if people get data, there's kind of taking the first step. The data will tell them, is it psychological or is it physical? Because you don't. I mean, it's one thing for a guy who's 25 years old who struggles to get it up, for that guy to go online and get some pills. I don't have a problem with that. For guys 45, 50 years old or older, they could have a physical problem, and that's worth sorting out. And then the other problem, I'm looking for the male side, is the solution could be quite simple. The solution could actually be putting a ring on. So instead of having to talk about the things that are difficult to talk about, just the way men no longer really object to their wives using vibrators, the partners using vibrators. Ideally, women would not object to men using erection rings, because they make things better. They make someone more confident and harder. So that's where I think it starts with getting data and considering using a ring. Obviously, there are other communication issues, and I think, and one of them, frankly, has to do with what men being really candid about what most satisfies them, what type of stimulation most satisfies them. And I think a lot of men are reluctant to talk about that, and women think that their vagina is everything, and it's not for most guys, especially for men. It's important. I'm not saying it's not important, but it's not the end all be all. And I would say, and I was surprised because from talking to probably by now, 100 to 150 men over the age of 50 or 55, that intercourse is what I would call intra-play for them. It's not what they necessarily do for them, the man, to climax. And that's, so I think and the doctors don't get this either, because we have these subjective scoring systems that are used by doctors called the erectile EHS, erection hardness score, or the SHIMS, or the SHIM test, or the ADAM, or the IIEF, and they're all focused on penetrative sex. Well, that's not what people are doing. Go ahead.
Yeah. No, just it's all very interesting. I think the more we demystify this and bring it out in the open rather than keeping it hidden, or only talk about it in the context of pornography, which seems to be, it seems we mostly talk about this in a more of a titillating way than we do in a more scientific way. It probably doesn't help that we're using words like cock ring and things, because those come from the vernacular of that industry rather than what the scientists use. What is the word you said that the scientists use for what?
Penile constriction device.
Yeah, right. But maybe it's for some it's easier to talk in those kind of terms than the other. But I think it's great to have these conversations, and I really appreciate you taking the time to be really frank about a lot of these things and to talk about it in the vernacular, because that's what people are probably talking about, even if they aren't in the more the sex toy industry and all the rest.
I'd like to make just one more point. I think it's really important for couples to plan for pleasure.
I think you're absolutely right. It's not always. It's an awkward conversation for a lot of people, though.
And it shouldn't be. Obviously, you want people to feel comfortable being spontaneous. But I'll tell you what, Paul, I'm a really good chef. If you were coming to visit me here in Montana, I wouldn't wait till you rang the doorbell to say, "Oh, what's in the refrigerator? Oh, we got some leftover rotisserie chicken and some hot sauce. I'll just serve that to Paul." No, I would plan a meal. And I think that it's interesting that people approach cooking and the gym differently than they approach sex. Now, I'm not saying people should have a whiteboard in your bedroom of what you want to do, but couples that are having less sex and want to have more sex and see that as a problem, they need to plan. And it's not just date night. They need to, because two nights a month ain't enough. And we know that actually scientifically. I discussed this earlier. We know the couples that have sex 3 or more times a week have half the divorce rate of couples that have sex twice or less a month. Yeah. Well, what's that telling us? People need to get it on in order to stay together. So plan for pleasure.
That's so true, but I know it's not there. I think, I don't know if it's as many men but I think it's more women who quite often think that the loss of spontaneity means the loss of romance. And they need the romance part to really get the juices flowing. So that's not always easy to.
It puts a lot of pressure on the man. So if you have a man who, because the sex is infrequent, lacks confidence, and this can affect guys who are 20 years old.
Yeah,
it's not just for guys my age.
Yeah,
if sex is infrequent and has been problematic in the past, and now you can go out to dinner. I hear about this about probably once or twice a week from guys about the date night failure.
Yeah, right.
Because it's you shouldn't have to do all that in order to enjoy each other. I think if people, and I see this at the gym, because I'm a doctor in sex, people talk about the sex a lot. You've got people in the gym 10, 12 hours a week, and yet you can't plan on sex for 2 hours a week. There's something wrong with these people are not dealing with the major issue in your life. You look fabulous, but your sex life is terrible. You need to plan for pleasure.
I did want to ask you two more questions about that, because you mentioned earlier that there is a relationship between cortisol levels and orgasms, regular orgasms. So that's one area. And I've also heard that there's at least a theory that orgasms for men on a regular basis are a way to avoid or lessen the potential for prostate cancer. Can you talk to either one of those?
I talk about all three of them, and even more bad is there are studies in men and women that show that they have an orgasm every day. They can cut it over the next 2 to 4 weeks. They will cut their cortisol levels in half, up to half. And most men, for most women, the results in women were actually more stronger than they were in men. Well, what's that saying? If you have stress in your life, masturbate or have sex. And we doctors should be recommending that to people. There's a big study out of the United Kingdom showing that men over the age of 70 have sex twice a week, cut their risk of sudden cardiac death by 50% over the next decade. That's a big number. And then you mentioned a third thing, which is prostate. Yeah. Well, men who have frequent sex significantly decrease their risk of prostate cancer and prostatic hypertrophy. So one of the ways in which we doctors are derelict is we don't mention these things to people. I wish that President Trump would go on the air and talk about how we not only want to make America great again, we want to make America happy again. You guys need to be out. You people need to be having more sex. I'm really disappointed.
Well, that is one area that I would trust him on. I think he seems to be quite prolific in that area. Well, thank you, Elliot, for taking time. It is really a fun conversation. Always interests me, and I'm always glad to try to demystify it a little bit, especially for the younger men who are. I know that just those years with the young babies and then all the changes are just massively depressing, and for a lot of men live in kind of like quiet desperation about how much their sex life changed after kids, and that there are ways to address it. And I think any conversation that talks about ways to address it and not pretend like, oh, it's just normal, my sex life's over at 30, go on and now just die slowly, is a good one. So people can find the more about you and about the product at myfirmtech.com, right?
That's correct. myfirmtch.com. And they can reach me directly at Elliot, ELLIOT, at myfirmtech.com.
Okay, great. All right, Paul Baines with GreatDad.com. You can find more things about my coaching services. I do not do porn addiction coaching. There are a lot of people who do that. But you can get my free resources, including my course on gratitude, for free if you go to GreatDad.com/go. So until next time, stay strong.
Thank you.